Congressman, you're saying they were really trying to hide prices. They wanted to hide the sticker shock. Isn't that the first thing that consumers wanted to know, was what their costs would be?
It is, and that was the frustration initially, was everyone wanted to get on and see what are the prices, and they found out they had to actually go through this whole data system, give all their personal information, give all their background, give all their salary information, their social security number, everything before they could get it, because the White House apparently wanted to make sure that people saw the subsidy. Now they've switched that. Now you can get on and just take what they have as a quick look, but the problem is now it's set up for these age brackets, and people are finding out that the estimate that they're giving you is actually much higher in real life. So now they're getting an estimate that's a lowball estimate when their price is actually even higher.
I want to ask, though, have you gotten a response to your letter to the administration?
We have not received a response yet on that. Our initial response was, we need to know all the facts, how this decision was made. That's part of our oversight responsibility. When something goes very wrong, we have to be able to find out, why did this happen, who made the decisions on this, and how do we correct this in the future. Right now we're in the gathering. That's a really good
point, is how did that decision get made to try to hide the sticker price? And do you think it was Kathleen Sebelius? Do you think it was some middle management bureaucrat? How would that happen? That seems to me to be a fundamental issue that we need answers to.
It is a fundamental issue. In July, I held a hearing and had the director of CMS, I had the head of the IRS, I had the IT individuals in front of my committee. We went through a questioning about this website and about the data hub, and the director of CMS at that time, the Center for Medicaid and Medicaid Services, told me directly, October the 1, it will be completely ready. We're testing it, we're evaluating it, it's going to be ready to go October the 1. Obviously, that is completely not true. Apparently, it wasn't true in July. It's definitely not true now in October.
It's unbelievable. It's so unbelievable, in fact, that even Democrats now are calling out the president. I want you to hear what Representative Rick Nolan, a Democrat from Minnesota, had to say about the president. Listen to this.
The president should man up and let us know who is responsible, who was in charge here, and fire him.
What do you make of that, Congressman? That's a Democrat talking to the head of his party.
That's the same thing that we have said for months, actually. People have criticized us for our tactics of what's trying to go on, but the reality is the same. We have said there are major problems, and people that believe the problem is just the website are mistaken. This is not just about website. This is the most visible portion of the Affordable Care Act. But if you walked into insurance companies, hospitals, doctors' offices, people that do HR in their companies, you would find that the exact same problems are multiplied all over the country right now. It's not just about a website. That's just the part that's visible. There are major concerns with the Affordable Care Act in every area.
Congressman, before you go, Kathleen Sebelius is going to testify, the head of the Health and Human Services, next week. What do you want to hear her address, and should she keep her job?
Well, I'll let the president decide if she's going to keep her job. She serves at the pleasure of the president. If that's the best representative that he has for his values and the way he wants to do business, he can go ahead and keep her on from there. The question that I really have for her is, how did this happen? How were the contracts made? And why was Congress and the White House told everything was operational and it's not operational? If we were told this is operational, it's clearly not even close to operational. What else is not operational like this? We need to know the full facts right now.
Unbelievable. Congressman Lankford, thanks for coming on tonight. Appreciate your time. Thanks so much.
Thanks.